So you finally decided to take a big step and get the LASIK procedure done. You've already had a friend or significant other go first, and now they won't stop raving about how great it feels to see without glasses. So why are you waiting? Yes, you're tired of your glasses fogging up or falling off when you're exercising, or perhaps wearing contact lenses has become too much of a pain, and all of the medical information you've read and watched has certainly been useful. Still, you have a few questions that you need answered before you can make a final decision. The big one is, how safe is the LASIK procedure? Well, millions of people have had the LASIK procedure performed, and it's quite safe and successful. The risk to your vision is similar to the long-term risk of wearing contact lenses. In fact, many LASIK surgeons who need correction have had LASIK done on their own eyes. A second question you probably have is, how expensive is LASIK? This depends on several factors like where you live and how much correction you need. LASIK is such a popular procedure that there are several credit companies that compete with each other to help patients finance their procedure. You can find some very easy payment plans. For many patients, the fees for LASIK surgery are easily offset by the cost of eyeglass frames, lenses, contacts, cleansers, and solutions over a lifetime. For others, being free from dependence on glasses or contacts is priceless. Another question that comes up is, who will be performing my LASIK procedure? And everyone considering LASIK should ask this. Over the last few years, the popularity of LASIK has led some surgery centers to build LASIK factories. In the industry, we call them chop shops, and the surgeons are known as shooters. Their focus is on expedited procedures and maximum throughput, just like a factory manufacturing line. Keep expenses low, see as many patients per day as possible, and get them in the door with the promise of lowest price. You've seen the ads. Everyone's a perfect candidate. But at Ocala Eye, close to a quarter of the patients who come in for evaluation are not candidates for surgery because of our stringent screening criteria. These criteria are driven by our one and only concern, the safety of our patients. It's important to know not only who will be taking care of you throughout the process, but also whether your care is delivered by a reputable medical practice that has been around for years and will be there tomorrow, instead of a franchised corporate store that changes doctors like you change clothes. And what about doctor interaction? You know, bedside manner? You don't want your first and only face-to-face meeting with your surgeon to occur 10 minutes before your procedure. If obsession with your care before, during, and after your LASIK experience is important, if you want an extended relationship with a practice that demonstrates concern for more than their own bottom line, don't let price be the deciding factor. Ocala Eye is not the lowest cost LASIK provider. Never was, never will be. Why? Because at Ocala Eye, our board-certified surgeons are involved in every step of the initial evaluation, to surgical procedure, to immediate post-op, to follow-up office visits. You can't get this level of high-touch quality care at a volume laser center. When it comes to LASIK, what is high-touch quality care? It's what we deliver every day to everyone who sees us for their vision care needs. Ocala Eye is the area's most comprehensive vision care practice. We began seeing patients in 1971. That's over 40 years. We're the first to perform the LASIK procedure in North Central Florida. We're the only facility with a separately controlled LASIK procedure environment with temperature, air pressure, and humidity controlled to optimal levels for patient safety. And at Ocala Eye, our surgeons are backed by other highly skilled doctors covering all the major subspecialties in ophthalmology. No other vision care practice in the region can make this claim. So, who is an ideal candidate for LASIK? If you're older than 18 years of age, have a stable eyeglass or contact lens prescription, don't have any serious medical issues, and have realistic expectations about your laser vision correction, you might be a potential LASIK candidate. Then, what's the next step? The first thing to do is call to schedule your complimentary initial evaluation. This is where our refractive coordinator takes some measurements on your eyes to make sure you're a good candidate for the LASIK procedure. This is a free visit, and you're under no obligation for any future procedure when you're scheduling a screening with us. If the testing and measurements determine that you're a good candidate for LASIK, then you'll be scheduled for a complete dilated eye examination with one of our LASIK surgeons. This is one last double check of your eyes to make sure that it's safe to proceed with your LASIK. There's no charge for the initial evaluation or the doctor consultation. If you hate impersonal medical care, if you hate high-pressured sales tactics, if you hate being treated like you're at a fast food drive-thru, then stop shopping around and call now. We'll prove everything you've seen in this video is true.